This conference will now be recorded.
So welcome to this MRCOG1 session. Um, so let's see that what is this exam. So basically this exam is going to test your basic knowledge like that. And as you might have checked that you can take this exam immediately after passing your MBBS final, and then you can take this exam. You need to make an account on the college website, and then you can check your eligibility. And but it is advisable that you should take your house job internship, and then you should go for this exam because you should know about little bit of this practical aspect of OB/GYN because some of the questions are going to be very clinical. So when you are preparing for exam, where you should look for many questions. So the questions are going to be what you should do, why you should do, and who can take and how we can take the exam. If you will go to the RCUG website, they have given these frequently asked questions. Okay, and you should, as you know, that for part one, you are not required to take any training like that. Okay, so candidates they are eligible to enter for the part one exam when they have obtained their primary medical degree. However, candidates they are advised to attempt the exam only after they have had some grounding in postgraduate OB/GYN. So that is going to help them. How you're going to submit your eligibility, you are familiar with it, that you will go, you will complete this form, you need to make your account, and then you can send this email. You can find this email on the college website. After that, you should give the college some reaction time. It will take some time, and then you can file your own application. So as you know, the next exam is going to be on 5th of July 2021. So the things, the date that when they are going to open the applications, what are the eligibility deadlines and the other stuff, all of this info will be available on the college website, but right now we don't have any info on that. Applications, you know, it's very easy to fill your application. So just go to the college website. There you are going to find how to book the part one exam. So first come, first serve. That is the basic principle, okay? And then they will say that booking applications are now open. This is for since they have not opened for the new exams, so you can see the slide for the older exams. Regarding the destinations, now they have changed the destinations. London and Ireland, they are always going to be on the list. London, Manchester, Glasgow, Belfast. This is in Ireland, so all of these are going to be there, but some of the stations from here they will be taken. So the college has not still announced, so we need to see that, wait for that. But you should visit college website regularly. Then how do you apply? So important for you. This is a two-stage process, eligibility and booking, and these are two different things. Having one doesn't mean that you have done the other one also. Eligibility and booking, these are two different steps. Just go and make your account, get your eligibility tested, and then apply for the exam. So you have to provide the proof of your college degree, primary degree, and then how you will get your these documents attested. So all guideline is given on the college website because basically we are talking about the exam preparation. So before sitting the exam, you will like approximately 4 weeks before the exam, you are going to get your entrance ticket. Now the exam has moved to online, so you need to go to the specific centers. Another important aspect of taking exam is that you can take total 6 attempts. Under any circumstances, no more than 6 attempts. So the candidates who want to apply for the Part 1 MRCOG who have unfortunately failed on 6 or more previous occasions, they need to provide supporting documentation from their head of school or the college principal, and they can outline the exceptional reasons for permitting a further attempt at the exam. So if you are preparing well, then don't have to go and apply for it. So try to pass the exam in your first attempt. Your first attempt is the best chance, and then the second best attempt will be the second attempt of the exam. The studies have shown, the research has shown that after taking the second attempt, your chances of passing on it, they will keep dropping like that. Previously, there was some gap between part 1 and part 2, but now after passing part 1, you can immediately go and take part 2. No, nothing about that. Then you should complete your full exam within 7 years. So after passing part 2, you need to sit for part 3 exam. And even if God forbid somebody fails part 3 exam, they don't have to take the part 2 exam again. When you are going to the college, you need to bring your entrance ticket and your photo ID. Could be your passport, could be your national ID card, anything can be there, but the entrance ticket is required. No ID, no entry. So the most challenging part is to manage your time. Sometimes, so you should remember that people are already working at higher levels, like you're working as registrars, specialists in some healthcare setup. But this MRCOG1, you need to read all basic sciences thoroughly, and then you should know that these sciences are basically related to the OB/GYN, but some of the things they are totally unrelated to the OB/GYN material. So you should make a good routine, and then you should stick to that. Make a realistic plan, and then you should know that you have to do certain things very regularly. So the first advice I can give you is that give yourself ample time. Usually 6 months they are adequate, 6 month block. Okay. So I will tell you about the books also. So you can prepare yourself. Different books are going to be helpful. And then it doesn't mean that taking the exam doesn't mean that you need to study like 10 hours a day. No, you should be regular, and you should know yourself that how much preparation do you need. That is the point. Regarding the exam, you know that they are going to test you on the single best answers. That is one thing. Then, since this is on the computer, so the things are very easy. So it should not be an issue like that. So basically, we are going to focus on the questions. SBAs, they can be on K1 type or they can be of K2 type. K1 means that they are asking you to give them simple, direct answer. K2 means that you will read the question and you will understand that what is the scenario, and then you are going to apply your basic knowledge, your clinical knowledge to answer that question. So let's say this question has been taken from the RCOG, that a 24-year-old girl patient presented at 27 weeks into her second pregnancy. She is feeling unwell with backache, fever, and rigors, and she has a temperature of 39.5 degrees centigrade. Urinalysis shows leukocytes and proteins +3, and the BP is 80/50. So what is the most appropriate initial management? So if you will look at the options, two options would be very closely matching to the answer. Two options, they will be partially providing the answer to this question, the initial best management, and one will be totally out of context. So here, obviously, you know that you need to take the samples from the culture, you need to commence antibiotics, and you need to arrange ultrasound also. And then we need to give, she's at 27 weeks, baby is at threshold of viability, so we need to give magnesium sulfate, we need to give antenatal corticosteroids. That's why this info is important. But they are asking you about the best, most appropriate initial management. So that is to admit to ICU, HDU for IV antibiotics and supportive care. Of course, we are going to do this ultrasound, the renal tract. We are going to do ultrasound for fetal biometry. We are going to give her antibiotics and we are going to give her um, antenatal corticosteroids for achieving fetal lung maturity. And then, of course, we are going to manage her in a multidisciplinary team. Regarding the division of marks, all questions are important and they will ask you how you are going to answer the questions. Each question is going to carry equal marks. So as you know, there are going to be two parts in the paper one. You are going to answer the questions on anatomy, biochemistry, embryology, endocrinology, epidemiology, biostatistics, genetics, and physiology. Why this info is important? Because you should be ready to face the questions here. Okay. Then in the second paper, you will have questions on biophysics, clinical management, data interpretation, immunology, microbiology, pathology, and pharmacology. In the later part of this session, I will tell you that how many questions you should expect to answer from each discipline. So these questions will be there. RCOG has given a detailed information like what should be read, what should be given, and what you're supposed to cover. So each paper is of 2.5 hours duration, like 150 minutes, and you need to answer 100 SPAs. Then you will have a break for 1 hour, and then you will go to the second paper, and again you will have like 2.5 hours, 150 minutes, and again you have to answer 100 SPAs. There is no limit on the number of images. They are flexible and they can show you anything. And with the computer-based testing, it is very easy for them to include many images, tables, lab results. So don't worry about that. You need to have a thorough knowledge to answer such questions. So the basic subjects, anatomy, genetics, then embryology, biochemistry. Embryology, you have to do very few topics. Biochemistry, yes, limited. Physiology, you should have an excellent knowledge of physiology. Then that's why we are devoting more time even during our course to prepare for physiology, because you need to do a lot of stuff. Basically, you should have good concept. If you have good concept, you can answer the questions appropriately with more confidence, and that will be an informed answer, okay, based on the knowledge. Then endocrinology, very important. Then pathology, pharmacology, you have to do general pharmacology. You should know about the general principles, and you should know about the specific pathology also. Pathology and pharmacology, both basics as well as the advanced. So these two subjects are going to trouble you a lot. Then this microbiology and immunology, yes, general structure of all bacteria, viruses, fungi, and parasites. You should be familiar with them. How do we do that? I will tell you in the later part. So immunology is very important, very heavily tested. Microbiology is very heavily tested. Expect to answer many questions on that. Biostatistics, very important subject. This is something you cannot learn by reading books. You have to work with practical examples. You should have a good concept if you want to answer the questions. We can help you here with a lot of stuff, helpful stuff. Biophysics, basic principles of ultrasound, basic principles of X-rays, and the stuff like that. Then what doses of ionizing radiation are safe in the pregnancy? Then how do we interpret data? All of these things are important. Then management of OB/GYN clinical conditions is very important. Intrapartum care, I can't tell you that how much important it is. Cannot overemphasize it. Ask the students who have taken the exam previously. So this was quite a challenging area. They can show you different CTGs. They can show you different fetal blood sampling results. They can give you different clinical scenarios, both emergency and non-emergency setting. Could be regular follow-up, could be anything, could be an anomaly. So you should be able to identify these defects. Ethics, more and more questions they are including on ethics. You should have a clear concept. What are the consent guidelines? What are the principles of obtaining these consents? All of this info is very important. Then you need to take many mock exams and the stuff. In 2019, RCOG, they changed the syllabus for many modules. So don't worry about that. We will give you quite up-to-date information like that. So you should remember that now, if you're preparing for the part 1 now, that's very good. But give yourself at least 4 months. You cannot prepare the exam in less than 4 months. If you have already taken the exam, still you need to have spend 4 months for taking this exam. So what you have to do is that you have to choose a book. The people who are coming to attend our course, We don't encourage them to read any other books because they are going to read our notes and they are just enough to answer any exam questions. Then you don't have to do like 10 books on the SPAs. You have to choose like 3 to 4 books. We have excellent, this question bank, and we have like the mock exams also, plenty of the exams. And all of these exams and the quizzes are available on computer. So you will have real-time practice just like the exam. Like you will click on the answers, you will submit the question, your exam, and then you will get your result immediately. But you will need to enter your email ID. I think it's like that. So the number of hours per day, they are not important. It is important that at least spend 3 to 4 hours a day. And this should be good quality study. Like you're not just reading or the book or flipping it, you are focusing on the subject, you are understanding it, and then you are asking yourself that have I learned it in a good way or not. After that, you have to answer, practice with the questions on the same subject. As you will be approaching your exam, then I will ask you to spend more and more hours on the exam. And you can go up to the upper limit is like 10 hours. Then studying for more than that time is never going to be productive like that. So you should also keep some days for the emergencies, like if you have small kids or you're visiting family or you're busy with work. So sometimes you will be unable to study also. So since RCOG has changed many things, so you should know that what exactly they expect from you. So overall, the part 1 MRCOG, it covers basic and applied sciences. So you have to cover the basics and the applied sciences. You should be very clear, which are relevant to the clinical practice of OBS and gynae. So this is like they have given the specific modules. In each module, they have given you some advice, which I'm going to tell you that now we are covering this part and now we are going to cover the next part like that, because you should be fully prepared. So you should have good fundamental scientific knowledge, and then you should also know that on the basis of this basic knowledge, you will develop your applied knowledge, your practical knowledge like that. Basically, you have 15 core knowledge areas and which are divided into 4 domains of understanding. And then in each part, they're going to ask you specific single best answers. You may find this information boring, but this is very important for you. You should understand cell function. So it means you should know about physiology, endocrinology, and biochemistry. Then the second part is understanding the human structure. So it means good knowledge of anatomy, embryology, and genetics. Third domain is, these are all 4 domains. Third domain is understanding measurements and manipulation. So it means you should know about biophysics, how much dose of radiation is safe for the patient during pregnancy, outside pregnancy, epidemiology and statistics, then data interpretation and pharmacology. Last, or the 4th domain is understanding illness. It means you should know about immunology, microbiology, pathology, and clinical management. So you can see here that they are going to ask 50 questions in each of these 4 domains. Okay, so that's why very important to know that what you should read, what you should not read. If we go to the knowledge areas and the requirements, you can see here that this has been taken from the RCOG curriculum. You should have some clinical skills. You should have teaching and research experience. You should know about the core surgical skills. This is in addition to the basic knowledges. You can see here, this is the part 1. This is highlighted in the cream color. So if you will look at this one, you will know that you are required to know the clinical skills, teaching and research, core surgical skills, post-operative care, antenatal care, maternal medicine, management of labor, management of delivery, postpartum problems, then gynae problems, then subfertility, then sexual and reproductive health, early pregnancy care, gynecological oncology, and urogynecology. So basically, you have to cover the basic sciences relevant to these disciplines, these modules. Okay. So in each area, they are telling you that what you should know about. So don't worry about it. As we will go through the course, we are going to talk about them. Clinical skill, it means that you should know about, you should be able to understand the symptoms and importance of the risk factors. Then pathological basis for physical science, like if they're telling you that there is salpingitis, so immediately it should come to your mind that they're asking you about inflammation. So they will not ask you that how you're going to manage that. They will ask you that which process is causing it. And then clinical investigations, which investigation should be done, and then how to interpret the results of the clinical investigations. Second knowledge area is teaching and research. So here you should know about principles of screening, clinical trial designs like single-centered RCT, randomized control design, or this is a multi-center or the collaborative research, and the statistical methods used in the clinical research. Levels of evidence are very important. Quantification of risk, power of study, level of significance, informed consent, and ethical and regulatory approval research. Then principles of safe prescribing, and then quality control in medicine and the accuracy of that test. In the core surgical skills, you should know about many different procedures. They will ask you about the indications, contraindications, complications, failure rates, and stuff like that. So during the course, we are going to cover all of these areas. Then it also includes careful patient selection. You should know about the principles of different surgeries, what different procedures like diagnostic lab, histoscopy, gynecological laparotomy for different things, ectopic pregnancy, hysterectomy, vaginal surgery for prolapse, incontinence, and hysterectomies. All of these procedures you should be knowing about the basic surgical skills in OB/GYN. Then you should know about the general principles of safe surgery, surgical instruments, sutures, management of common complications of surgery, and then surgical team working, that how do you work with other teams, because the non-technical skills, they are increasingly becoming very important. Risk management and risk reduction. In the post-operative care, you should know about all different complications. So as I will take you through the course, I'm going to tell you about all of these things. I believe that you are already dealing with these problems, but we will look at these things with the exam perspective. In the antenatal care, you should know about the maternal, anatomical, endocrine, physiological adaptations which are occurring in the pregnancy. Then you should know about pathology of the major organ systems and the common hemoglobinopathies, connective tissue disorders as applied to the pregnancy, screening, normal and abnormal fetal presentations, development, function, principles of inheritance of different disorders, and how to define and interpret data on maternal, neonatal, and the perinatal mortality. What are the impacts of maternal health and the other variable, what are the other variables, how do they affect maternal health? So all of these things are important. In maternal medicine, you need to know about many different conditions. Of course, you should know about the risk factors, epidemiology, the best investigation tests, the general treatments. You're not required to know about everything. So you can see here that the college is giving this information. As I told you that this info has been taken from the college. You should be able to interpret different lab results, complications, ultrasound, x-rays, MRIs, and how to interpret their results. Choose the relevant test, which test you should do, and then how you should read about them. Regarding management of labor, you should know about physiology, biochemistry, endocrinology of birth or parturition, including maturation of the fetal endocrine system, influence of hormones on signaling pathways in the myometrium, and the biochemistry of myometrial contractility, principles of gluconesis and stimulation of the uterine contractions, how you are going to induce labor. You must have seen in the recall that they are asking you about different types of prostaglandins. Fetal physiology in late pregnancy, fetal assessment in late pregnancy and labor, and how to interpret the results. Fetal blood sampling results, CTG results, presentation and the implications of infection on labor, and the optical therapeutic options like that. So you can see that this area is very practical, very much clinical, but you are required to know the basics also. Similarly, in the management of delivery, you should know about labor, mechanism, physiology of childbirth and the third stage of the labor, etiology, pathology of congenital and the bone malformations on the genital tract, mode of action of drugs which are used in labor, delivery, and in the third stage of labor, indications for and risk for operative delivery, biochemical basis of acid-base balance, normal fetal physiological changes in labor, and how to interpret fetal and cord blood analysis, female perineum, and principles underlying the management of the perineal repair. In the postpartum problem, you are required to know about physiology and the structural changes in the neonate, physiology of lactation, uterine involution, and the pathology and management of puerperal sepsis and infection, common complications in puerperium, including mental health issues, very important and challenging area. You should know about the principles of postpartum contraception and other drugs used postpartum and during lactation. Now we go to the gynecology, anatomy, physiology, histopathology of the pituitary glands and the female reproductive system tract, including an understanding of changes at puberty, at menopause, and during the menstrual cycle, including ovulation. Epidemiology, microbiology, and therapeutics of the benign gynecological conditions, including infections, how to interpret results of commonly performed investigations for benign gynecological conditions, principles of medical and surgical management of gynecological pattern. In the subfertility, you should know about epidemiology of subfertility and the treatments, anatomy, development, function, cell biology of the organs of the male and the female reproductive tracts in the context of their relevance to their fertility and its disorders. How to interpret results of investigations commonly performed as part of the investigation of subfertility. The next area is sexual and reproductive health. You should know about physiology, endocrinology, epidemiology, and pharmacology of contraception. Epidemiology and serology of sexually transmitted infections, the microorganisms involved, the drugs used in their treatment, and pathological features of STIs. Termination of pregnancy, including assessment, preserved competence, then surgical management, and the drugs used in the medical termination of pregnancy. Then in the early pregnancy care, you should be thorough with basic sciences pertaining to early pregnancy and its loss, including the endocrine aspects of the maternal recognition of pregnancy, the luteal maintenance of pregnancy, and the physiology of feto-maternal communication, etiology and histopathology of miscarriage, ectopic pregnancy, and trophoblastic disease. Diagnostic features of ultrasound used in the early pregnancy, the epidemiology of the pregnancy loss, and the medical agents used to manage pregnancy loss. Like loss can be in different forms of miscarriage, ectopic pregnancy, and trophoblastic disease. How to interpret the results of investigations used in early pregnancy problem. In gynecological oncology, you should know about surgical anatomy of the abdomen and pelvis, cellular biology of cancer, genetic origins of cancer and principles of diagnosis and screening for gynecological cancer, pain pathways, transmission of pain centrally, and pathology of pain in gynecological malignancy. Epidemiology and etiology of cancers affecting women, pathology of and classification systems for gynecological cancers and pre-malignant gynecological conditions. Principles of radiotherapy and chemotherapy in the management of gynecological cancers and their effects on gonadal function. The last area is urogynecology and pelvic floor problems. You should know about structure of bladder, pelvic floor, and their innervations. Mechanism of continence and micturition and principles of pelvic floor sport. How congenital anomalies, pregnancy and childbirth, disease, infection, and estrogen deficiency they affect these mechanisms. You should know about principles underlying the treatment of bladder and pelvic floor problems and the impact of other drugs on the bladder function. So, Like I told you that our notes, they have been prepared according to these latest guidelines. Then we have the Q bank also. It contains like 1500 SPAs. Some of them are contained in the quizzes and some of them are present in the mock exams. So now important that what books should be read. As you can see here that the RCOG recommends many wonderful books, and in addition to the books, another important point is that they have recommended the list of the MCQs also, which you can do. But then many of the students, they don't know that even for the part 1, they are required to read the obstetrician and the gynecologist, which is the quarterly journal of the college. They are publishing it every 3 months. So we are going to give you important summaries, and then you can see here, this is mentioned by the college, okay, that we need to answer in the talks. You need to answer the CPD questions also. So our team of experts is going to answer these questions for you, and you need to do them. And then we are going to test you on the same topics also. Then again, the RCOG expects that you must have covered at least green top guidelines. As we know that what information is important for you, so we are going to give you very summarized or concise notes on these conditions, because doing all of the green top guidelines and the nice guidelines, consents, and then other informations like scientific impact papers, these are not humanly possible. So only the important stuff which is tested in the exam, we are going to put that, include that in our course, so you don't have to worry about it, or you're not required to read the full guidelines. So the college says that their own experts, when they are writing the exam questions, they are referring to these guidelines. So you should expect to find many questions from the based on the green top guidelines. So the important advice, how you're going to prepare for it. So once you are with us, then you should know that you're going to answer all of these questions. Going to the books, you're going to read our notes. And if you're not in our course and you want to prepare on your own, then you should remember that first reading should be from the Basic Sciences for MRCOG, that is by Ellison, but that's a huge book, very big book, but you need to cover that. In the second revision, you can go to the revision notes, but some of the content has not been updated, so you should be very careful about it. Regarding the questions, you need to answer the SPAs from the college, and then you will do our own Q bank, and then we will give you some other MCQs also, and the past papers which were published by the RCOG, and the recalls which are given in the social media groups. We have tried to solve with reference these recalls also, so we will give them to you, but you should remember that college is always going to make new questions, so you don't have to rely on the same books like that. Okay? So in each discipline, the college has asked specific things, and you can see here, as we will go through all of these things, we are going to give you all of this information. So don't worry about it, because we are following the college syllabus, and we are going to answer these questions also. So you should remember that when we are talking about paper 1, different things are going to be there. Now the question is that how many questions you should expect to answer from each specialty. From genetics, like 12 questions, anatomy 20 to 22, embryology 13 to 14 SBAs, physiology 19 to 20, endocrinology 15 to 17, pharmacology 20 to 21, pathology, you can see here, that is one of your major subjects, 23 to 24 questions, then biostats 9 to 10. Then microbiology and immunology, like 10 questions, biochemistry 4 to 5, biophysics 6 to 7, and data interpretation and the clinical management, you should expect to answer like 20 to 22 questions. So all of this information will be given to you during our course. So we have just covered each subject topic wise. Each topic has been mentioned which the college expects you to cover like that. Then in addition to our notes, anything we need to do from other books, we are going to tell you about that also. So we are telling you about the main topics, and then we are going to the other parts. So you can always look up the other videos where you can find the sample medium sample materials, also sample recordings like that, course samples like that. Biostats, it is going to be like very challenging, but we have divided it into different topics, and you're going to find all of this info on the web page, so don't worry about that. Vaccines, immunology, all of these are very important, and you have seen that they are going to ask you plenty of questions from here. So once you are with us in our course, so you don't have to worry about many things, because all of this info we have filtered out for you, and it is going to save your time tremendously. In each subject, we are going to tell you what are the most important topics and what you can leave and what you cannot leave. So this is very important. You don't have to read from many different resources or stuff like that. Okay? Another important issue is that how you should manage your time. So time management is very important, and you should know that when you are going to take the exam, you are having enough time to answer each question. Like you will have like 70 seconds to answer one question, which is quite sufficient. So read the question very well. So after that, you should know that when we are answering the single best answer questions, then either you know the subject or you don't know. But then don't look up at just the part of the question and then answer the part. No, that is not required. So you have to read the question very carefully, make sure that you have understood the question, and then without looking at the options, try to think about the answer. And once you have reached that decision, then look up for that option into the questions. If you find it, that's very good. The frustrating part is that sometimes the answer which you have reached, you will not find that into the options. So now you can go to the second best option. That is the way of answering the questions. So you don't have to be quick. You can go just at your normal pace. Just read the question. There are different techniques for answering the question. Like, first of all, you should neutrally read the question. We call it neutral read, without having any guessing any answer. Just read the question, okay? Then if you're not finding the answer, just notice, you can always highlight the questions, okay? So just highlight the question, okay? What exactly is given there? So find 3 points in the question stem. If you have found those 3 points, then by this time you should have a good amount of information on the question. Okay. Now again, go over the options and see that anything is given there or not. If it is not given, then look up which option matches best, select that and click on that. Don't leave any question unanswered, because there is no negative marking for it. So really you can do very well. If you're not happy about any answer, you will have some bars on the left side. You can mark that question or just write down the question number, because if you're not happy, then in the end you should go and try to answer these questions. So time management is very, very easy. Don't worry about that. And then you should remember that you should be able to answer all questions. Don't skip any questions. Read the questions very well, and you need to practice answering the questions right from the day one of your exam preparation, like that. Okay? So when you have joined our course, the good thing is that this has general advice about preparing for and taking the exam, comprehensive coverage of the part 1 MRCOG syllabus, and practice SPS sessions are also available, and you will also have the opportunity to do several mock exams during the course. And what are the learning objectives of the courses you have joined? Become familiar with the Part 1 MRCOG syllabus and exam structure. Revise the key areas of the Part 1 MRCOG syllabus. Practice large number of typical exam questions. Become confident with the various types and formats of the exam questions. It offers a comprehensive course of lectures which are given by different experts in their field, and we are going to cover all components of the exam. So if in the meanwhile, if you will have any questions, any problems, you can always contact your mentor. You will have, with passage of time, you will have live sessions, all basic sciences, clinical guidelines, data interpretation is covered. Then topic-oriented tests are taken, then mock exams are conducted, and you will have access to the recorded sessions till you take your exam. Then we have active groups on the Facebook, WhatsApp, and Telegram. So as your course has started now, so you have plenty of time to cover everything. So in addition to these sessions, you are going to have regular homeworks, which we are going to give according to the working hours available for each candidate. Every month you have to take mock exam, then 90 to 95% success rate in the first attempt, inshallah. So this is the sequence of teaching, that you will have online lectures, or you have, like right now you are dealing with, you are able to hear the recorded sessions. Then you can have, these lecture notes. The PDF is also available if you want to read. Then online pre-test quiz and the mock exams, they are also available on our website. Full QBank is available, and then screenshots of the materials which is shared with the patients. All of these things are available. So you will have, basically at a glance, you will have live lectures, lecture notes, then the recorded lectures, then the pre-test quizzes, mock exams, and then in the last part of the exam preparation, you are going to do QBanks. So why we are different, that we are just teaching to test. It means that you should take test and you should pass your exam. No unnecessary teaching and no wastage of time. No extra reading. I will never ask you to read different things like that. So notes are used. Then we have different folders. We will give you with passage of time the different pictures, diagrams to explain different concepts, and where possible. And then, like the questions, quizzes, mock exams, QBanks, and we will provide you with everything which is required for passing the exam. You don't have to spend money or time on extra resources. Then we have individualized plans to help the students, and we can also give, like, if your teacher thinks, your mentor thinks that you're not ready for the exam, then they can always give you extra coaching also. So we have been doing it since 2002, and we are present on social media. You can trace us on all, you can track us on all important social media apps. No problem for that. So in the end, this is our email. If you have any questions, any problems, you can always ask us. You can always ask your mentor. In your case, I'm your mentor, so you are free to have any access, any questions, anything. So here is the email, and here is this is WhatsApp number for easy communication. So I don't think that you will have any problem during the course like that. So in the end, I would encourage you to ask me any questions you have, and then I wish you all the best, and I look forward to your success in your exam in your very first attempt. Thank you very much for listening to it.